All right, people, welcome to One Body, episode 1. I'm Kruesi.
I'm Eden.
And today we're talking about GERD, G-E-R-D, which is gastroesophageal reflux disease, which is basically just reflux when it becomes problematic and annoying.
Womp, womp.
Yes. But before we get nerdy with the GERD, let's just talk about who we are and what we're here for.
Yeah.
So, like I said, my name is Kruesi. I'm 30 years old. I'm from Chattanooga. I'm living in Atlanta with my husband. Shout out Ethan.
Woo.
And our cutie booty little baby. Shout out Palmer. And I'm a physician associate. I got my degree from Emory University. Before going to PA school, I worked in the health promotion world. So I was a health coach, personal trainer. I was a yoga instructor, which was tons of fun. I got my yoga teacher training from Australia after college, which is probably the coolest fact about myself. And I somehow always weave it into conversations.
You were a true yogi in Australia.
Yeah,
So
I really was.
cool.
I almost got like 10 tattoos at that time. I was a different person. But the good things have stuck with me. So before going to PA school, I was working in health promotion. That's really my core, but I love the science and medicine that I've learned through PA school. I've been working in the traditional medical system. I've been working in one of the main hospitals in Atlanta, and that's been great. This idea for this podcast is kind of a marrying of those two worlds. I love health promotion. I love lifestyle and talking about things we can do to make ourselves more healthy. But I also love the science and the medicine and getting nerdy on all of that. And I'm here with my sister and friend, Eden.
Hello?
You introduce yourself.
Oh, hey guys. My name's Eden. I'm 26 years old. Kruesi's younger sister. I'm a speech language pathologist, married to my husband, Richmond. What else did you say?
Where'd you go to school?
Oh, my undergrad was from Belmont University in Nashville, and then I got my master's at Auburn University.
Go Tigers.
Go Tigers.
And Eden lives in Chattanooga. She's a ton of fun. She's a great hang. So the whole point is to help people understand their bodies better. And that way you know what's going on when you have some weird symptom come up, you or a friend. And then when you go see your medical provider, you feel like you have more agency over your body. You have good questions to ask. And you feel like you know some of your options so that you're not just cornered into like you can only do this one thing. It's surprising to me how many of my friends and our family too, that women are in our season of life, we just don't understand our bodies.
Yeah.
And so I just keep having this idea of going through specific medical conditions and issues that we have and going deeper.
And you go to the doctor and you have like 5-10 minutes with the actual physician, and if you aren't prepared and don't know what questions to ask or don't even understand what's going on, it's sometimes not very helpful.
Or you just feel like a little lost. So hopefully we can clear some of that up. I will say, although Eden and I are both licensed healthcare providers, we are by no means acting like we're experts or we know like all of the details about these conditions. But we have a really good foundation of science, biology, medicine. Eden's more specialized in her specific field, obviously, but I think that gives us a good foundation to be able to ask questions. We'll have guests on who work in the specific field and pick their brains on what's important for non-medical people to know about the condition. And all of the information here is for educational and entertainment purposes.
Yes.
It's not by any means supposed to substitute any advice you get from your provider. Obviously, this is just general information. It's not personalized to your needs. So you got to ask your provider directly. Yada, yada, yada. Okay, so a little bit more about us before we jump into GERD today. We come from a big family. There's 6 siblings total. There's 2 boys and then 4 girls. Eden is the 5th. I'm the 3rd, so I'm the oldest of the girls. And coming from a big family is tons of fun. We're actually right now in our oldest brother's podcasting studio. Shout out to Hudson.
Silver Bullet is the name.
It's called the Silver Bullet, and he is the best. What would you say is your favorite part about growing up in a big family and having a bunch of siblings?
It's just so much fun. Like, there's always something going on. You have built-in best friends, and in every season of life. So sometimes you have friends that are maybe more situational or really helpful for that one season. But it's like we all keep growing together, and there's always someone to ask for help or a new perspective. And everyone's so cool. Everyone's doing amazing things. So it's inspiring to have such a big family. That's really cool.
Yeah, I would say the same. I think having a bunch of siblings has always just been a big party. It's a lot of fun. I remember in high school walking down for breakfast early in the morning before school, and there would already be like 4 or 5 people down there having breakfast, hanging out, and so there's just never a dull moment. Now it's really fun, too, that some of us are having kids because we can know each other's kids really well and be a part of each other's lives in a new way, which is really fun. And there's always someone to get advice from, or if you just need a buddy to like go do a boring chore with you, there's always somebody around. Yeah. So it's really fun. On the flip side, though, we always talk about how having a lot of siblings, it makes it kind of hard as far as your capacity to really spend the quality time and have like deeper conversations with every single one of them because your time is kind of capped. But there's different seasons. It's been fun to think back on different seasons where like currently you and I are interacting a lot because of this and both being in like the medical and healthcare field. It's fun, but then there's been times when I've been way closer to other sisters or whatever. It just depends on the season. So
I remember whenever I got married, I feel like there were new things for us to talk about, or just new questions. I understood you in a new way, and it's cool to think how that's going to continue to happen. Yeah. As we have kids or as we change careers or move cities. But yeah, I agree. I think it's amazing to have so many people in a family, but there are like pros and cons to it.
Yeah. You've also said before that as especially one of the younger siblings, it can be hard to find your own identity and not follow whatever the older siblings have done.
Yes.
But it's cool because you decided to go back to school and become an SLP on your own terms. I don't think anyone in our extended family does speech pathology. So talk about why you decided to do that and then through school and now working as a speech path, what you've learned about yourself.
Yeah, I think that honestly was a big part of it that I maybe realized later. It was very attractive to me to pursue something that no one else had done in our whole extended family and to have like a specific title and a very specific skill to offer. I didn't really feel like I was really good at any one thing. I was like pretty average at lots of things, which is good,
average gal.
Yeah, that bothered me. And so I was undecided in college, had no idea what I wanted to do. I didn't even want to go to college because I didn't know what I wanted to do and I didn't see the point. But that's what all my other siblings did, so I just did it. And then discovered speech pathology kind of randomly through interning with a speech pathologist that was really good and sparked my interest. So I kind of changed directions. I kept my major as corporate communications and social justice.
Whoa, I didn't know that.
Yeah, well, my minor, like, you have like a focus, so kind of like an emphasis on social work, social justice, which was really cool. I loved the classes I took, but it didn't feel super, again, specific. Like I didn't know how to transfer that into a skill that meshed really well with who I was and what I was good at. And I feel like speech pathology did that, or sort of checked all those boxes. So then I went and got my master's and did all sorts of clinical rotations like you did. And now I'm working specifically at an outpatient pediatric center. But yeah, definitely love what I'm doing. I feel even more confident that it's what I'm good at. It complements my skills really well, but much harder than I thought it would be. Like grad school is a lot harder than I thought it would be, and just any clinical job is hard. You're working with people, which is hard sometimes, and you're working with people in need. You're working with people, like they're coming to you with a problem and asking you to fix it. So it can feel overwhelming. I feel like it's high highs and low lows. When you are able to solve a part of that problem or the whole problem, it's an amazing feeling. And when you're not, it's really hard to know how to handle that. Yeah. But I really enjoy it.
Mm-hmm. Yeah. My decision to go to PA school was similar, where I wanted to learn a specific skill that I could apply in a very specific way because I have a lot of things I'm interested in. And I thought it would be really helpful, especially wanting to be a mom too, to have a job where there's some flexibility. Mm-hmm. You can work in different specialties. You can dial back and work part-time pretty easily. And I had talked to a lot of PAs who were in that season, and it seemed like it was going well. So that was a big draw. And then, like I mentioned earlier, working in health promotion, I loved that world, and that's really my passion, is like true health. But I wanted to learn the science and go deeper into the medicine world too. So that was the impetus for that. And
so you decided to be a PA, which is like not a small thing.
Yeah. So that was a huge undertaking. I think PA school really humbled me because I think I'm a pretty prideful person, and I thought it would be easy for me. Like, just no big deal. You just go do it. You study and you're done. It was the hardest thing I've ever done because it's an extended amount of time. It's about 3 years, and this is after about 1.5 years of getting patient care hours. And you can't work, you can't do anything outside of school because it's an intensive. And, I mean, I was studying every second of the day.
She's like looking at, not Quizlet. What did you
Anki.
use?
It's
Anki, like under the table. She's like, I gotta go to the bathroom. Looking at Quizlet.
Let me go pee. I would have nightmares. I would be dreaming about anatomy, like studying anatomy and all this detail. And I would wake up in the middle of the dream of studying and be so nervous because whatever I was studying was wrong. It was inaccurate. And I would be like, oh my gosh, because I wouldn't know if I actually knew the information or if I had studied it wrong in my dream. Shout out to, okay, we cannot keep shouting out.
So
I'm thankful for my husband for just being a rock through all of that, because I was definitely not pleasant to be around. I was not fun, and I was stressed, and my eyes were always on my phone. Anyway.
Okay, well, you were still really fun to be around. But I'm sure he noticed.
Yeah.
You were dialed in.
I was dialed.
Yeah.
Dialed on the medicine and nothing else.
Yeah.
So, yeah, that's that. Okay, let's talk about GERD. Let's get smart. What'd you say?
Such
You
a
were
fun
like,
topic.
We were saying this is our motto. We're trying to have a
I
good
thought that
time,
was really good.
but we're not trying to waste your time.
Let's say it again.
We're trying to have a good time, but we're not trying to waste your time.
But really, like, yeah. Come on, this is going to be really good for you guys. You're going to learn a lot.
We're trying to be fun, and we're trying to make you smart. That's the goal.
So
fun and smart.
You laugh and you learn something.
Yeah, you walk away being like, oh, this is cool. I know something about my body.
Yeah.
I can tell a friend what they have going on. All that good stuff. Yep. It's important. We got to know our bodies. So today we're talking about GERD, G-E-R-D, gastroesophageal reflux disease. We picked this topic because Eden and I have both dealt with it in different seasons. And so we can talk about it personally, what we had going on. And then we also understand what's happening, the pathophysiology and everything, and how it's treated. So the definition of reflux is when contents of the stomach, which could be food and the stomach acid, reflux or move backwards up into the esophagus, which is the food pipe. Food should always be going down. It should never be coming back up. So that is what reflux is. And then gastroesophageal reflux disease is when it becomes problematic and it causes either troubling symptoms or damage to the esophageal lining. So why don't you give us a little anatomy overview of the organs that are important?
The reason I know this is because the muscles entrained for speech are the same for swallowing. So I did learn a lot about this stuff, and I think it's really cool. So next time you swallow,
it's really cool, guys.
You can think about all these things. You can be analyzing yourself.
You swallow 500 to 900 times a day. And in your sleep.
Yeah.
All right?
Yep, swallow in your sleep. So everyone has a mouth, your oral cavity. Everyone has a tongue. Well, most people have a tongue. You put the food in your mouth, you chew it up, your tongue lateralizes to form a bolus or a ball. You put that kind of in the middle of your tongue, and then your tongue should elevate and push the food back. If you're swallowing with your tongue pushed against your bottom teeth, it's actually a tongue thrust. It's not good. You need to change that. Yeah, it's a tongue thrust. And it could be affecting your sleep and all sorts of things in your oral structure. So don't do that. So when you swallow, your tongue pushes the food back, okay? The elevation of your hyoid opens up the sphincter that's at the top of your esophagus. It's called the upper esophageal sphincter. Super cute. It opens, the food goes in, and then it should close. That creates a pressure difference, peristalsis. It's a wave-like motion that moves the food down your esophagus. So your upper esophageal sphincter closes, the food goes down your esophagus through your lower esophageal sphincter and into your stomach.
Mm-hmm. Yep. Thank you. Yep. And then the stomach connects to the small intestine, the duodenum first. So the moment you start chewing a food, your stomach acid, which is hydrochloric acid, starts releasing from the lining of the stomach. And it's preparing, just getting ready for this food to come down. The acid is very important because it helps to break down the food, specifically the proteins, into amino acids. And then it also kills a lot of the bacteria that you ingest so that it doesn't end up causing an infection of the GI tract. So very important.
Cool.
But the stomach is built to be able to withstand that acid. The cells are hardy enough for that. When the acid goes up into the esophagus, the cells of the esophagus are different, so it's not able to deal with the acid as well.
Ouch.
So then it causes inflammation. The inflammation can cause damage to the lining of the esophagus and a lot of the symptoms of burning and things like that. So again, when things are functioning correctly, like Eden said, it should move through the mouth, through the food pipe, through those sphincters, into the stomach, and then into the small intestine and down. The GI system's so simple because it's just like mouth to booty hole. It's just like gravity. One big tube. Yeah, and everything should be going down. There is a physiologic or normal amount of reflux that happens throughout the day, and it's not problematic. It's usually asymptomatic. It's not happening at night usually. And what's happening is it's transient releases of the lower sphincter that's connecting the food pipe to the stomach. And it's releasing extra air that's built up in the stomach so that the pressure can lower. It's what happens when you burp, is that's like releasing. So if during those transient openings you have triggers or extra things that are causing the food to go up, that's when the reflux a lot of times happens. So we picked this topic because it's very common. 15 to 30% of people in the U.S. have it. And it's really troublesome. I think a lot of people brush reflux off as if everyone has it or it's no big deal. I'm being a baby, that this is like interfering with my life. But as Eden and I know, it really caused a lot of issues.
Yeah, so annoying.
Yeah, so tell us what you were experiencing.
I was experiencing some heartburn, like the classic feeling in your chest that's just really uncomfortable. Definitely burping more often. A globus sensation, so the feeling of something like stuck in my throat before, during, and after a swallow, like all the time. It was so annoying. Some sore throat, lots of like clearing my throat. I felt like I was just really irritated, and it affected definitely during meals because I was thinking about like how I was eating, how I was swallowing, like is something else going on. It affected how I was sleeping because I had looked up all these Google searches of what you're supposed to do and not supposed to do with reflux, so it was stressful to even sleep. And then I feel like it can make your breath, it can affect your breath. So like I was just aware of when I was talking to people, like
don't get too close to
yes,
Yeah.
And like it affects what you're putting, like I didn't know what I should and shouldn't be eating. So I was just really stressed whenever I was cooking or eating food out or getting a drink. I didn't know what to avoid.
And you love food, so
I love food and I love cooking. Yeah.
Yeah, and you had it during school.
Yes,
so
mostly during grad school. It started during grad school, so it has to be related to stress in some way because it has died down since then.
Yeah, thankfully. Yeah, and then I experienced it really suddenly when I was pregnant with my baby. It was about midway through. Once I had a bigger belly, I just got hit with reflux so hard out of nowhere. And I was so nauseous the first half of pregnancy because of the hormones. And then it started to go away probably for a week. I was like, oh my gosh, I'm back. And then my reflux kicked in. And my reflux was making me so nauseous. So I was kind of just nauseous the whole pregnancy.
That is so bad. Like that will take me out.
So long. I know. That was hard. So I think people don't realize that reflux can make you nauseous too. So those were our experiences with it.
I thought only old people had reflux, or if you were like severely overweight. Like, so I was like, what's going on?
What's wrong with me? Yeah. But we have a ton of friends who deal with it in a way that's problematic and they have to go see somebody for it. So other symptoms we talked about, the main ones are going to be heartburn, which is that burning sensation in your sternum and your chest. Regurgitation is the feeling of foods coming back up into the food pipe. Very unpleasant. And then you can have burping or belching. You can have that globus sensation. Some of the symptoms, if it comes up higher than the food pipe and into like the mouth and the pharynx area, that's actually LPR, laryngopharyngeal reflux, which is the same physiology. It's just coming up higher. So that can cause hoarseness, chronic throat clearing, like cough, a chronic cough.
Which can then actually lead to damage of your vocal folds and affect vocal quality and just the general health of that area. And it can even go up into your nasal cavity, like up in your nose, which
cause postnasal drip.
Yeah, so gross and uncomfortable.
Maybe even related to tonsil stones. It's not certain.
Yeah, stay tuned for that. I do have tonsil stones. I suffer.
You suffer?
I suffer from tonsil stones.
Yeah, you like are digging those out every
getting
night.
them out, yep.
So those are the main symptoms, and then nausea, like we talked about. The causes, like I said, it may be that nothing is wrong with the anatomy, but you have triggers during those transient openings. So common triggers are things that increase the pressure on the stomach. Pregnancy is a big one. And pregnancy is twofold because the hormone, mostly the progesterone, will like relax that sphincter, so food can come up more easily. And then once you get a big belly, it's just pressing up on the stomach and causing more reflux. Same thing if you have a lot of excess weight on the belly. And then a high percentage of people have a hiatal hernia, which is when the top of the stomach kind of pushes up a bit through the sphincter and into the food pipe. And that can cause reflux as well. So those are some of the triggers. And then other big ones would be stress. Stress causes you to go into your sympathetic nervous system, which shuts down the parasympathetic. So the digestion and the GI tract is part of the parasympathetic system. So if you're shutting that down, you're slowing down digestion. Food sits in the stomach longer, so it has more time to reflux up. And then it can cause some issues with the sphincters as well, like causing them to just not be as naturally opening and closing. So that's an interesting one. And then certain medicines and drugs, a lot of people now are on the GLP-1 agonists. Those also delay the emptying of the stomach, so it can cause a lot of reflux. There's a lot of medicines
because
that can
it's
cause
sitting in your stomach longer, so there's just more opportunities for it to reflux.
Every time it transiently opens, like it's supposed to, there might be food in there still, so it can come up.
Which kind of to your point of like the pressure on your stomach, I'm almost always wearing jeans that are probably too tight, leggings.
Yeah.
Like I'm wearing like a
tight
compression
clothes.
like outfit.
Yes. Tight clothes for sure.
So maybe we should eat naked.
Eat naked. Please, in your own room.
True.
Please wear like underwear at least. I don't know. And then foods. Certain foods can make your reflux worse. Acidic foods are a big culprit. Citrus fruits like lemons and limes and grapefruits. Apples are very acidic. Tomatoes, so anything made with tomatoes like pizza sauce, pasta sauce,
Ketchup.
Bloody Marys, ketchup.
Barbecue sauce. Ketchup.
Barbecue sauce. We're saying the same ones.
Yeah.
Dark chocolate. So the cocoa is very acidic. I actually looked into this, though, because I love chocolate. There's this thing called Dutch processing that I think they do in Europe a lot more, where they process the cocoa with this alkalinizing agent, and so it neutralizes it, and it makes it smoother and less bitter.
Huh.
So if you want to find a brand that is Dutch processed.
Milka is a European brand.
Milka.
But I
thought you were saying milk.
Milka, M-I-L-K-A. I don't know if it's Dutch specifically, but it's European, and it is so good, and I don't notice symptoms with it when compared to like
Is it really smooth?
Yeah, so good.
Buttery? Yeah, probably.
Purple package.
I know that one. It is good. Milk.
Milka.
Milk.
Oh, milk, yeah.
I'm actually talking about milk now.
M-I-L-K, the white stuff.
The white stuff can be tricky. If it's full fat, it can make your reflux worse. Fat also takes longer to digest, so your digestion slows down. You can reflux more. But sometimes milk is basic, so sometimes if you do like a non-fat, which I typically wouldn't recommend, but if your reflux is bad and you want to try non-fat dairy, maybe that could help. And then alcohol, tobacco. No. Makes it worse. Am I missing any foods?
Coffee. And
coffee, especially black coffee, like first thing in the morning with nothing else on your stomach.
Yeah. Wow.
Yeah.
Well, also, everyone talks about carbonated drinks.
Oh,
I think
yeah.
it's the fact that it makes you burp more.
And
so again,
they are acidic. That's why they can cause cavities. Yeah.
Okay. What about just a water, like a carbonated water? That can cause cavities?
Yeah, because it's carbonated with, I could be wrong, but I think they usually have citric acid
Well, I've
in them.
recently gotten into carbonated beverages, and I have 3 cavities. So
Lovely.
maybe I'm your
Maybe we
case
found
study.
the culprit. Okay, there's also a lot of things that could be causing reflux-like symptoms. So we talked about LPR, laryngopharyngeal reflux, which is reflux. It's just a different...
It's coming all the way up that second sphincter
Yes.
instead of just the first.
Yes.
Yeah.
So that might present a bit differently. We already talked about some of those symptoms. EOE is eosinophilic esophagitis. That is becoming pretty common. It's an immune-related reaction. It's very inflammatory where you get a lot of eosinophils in the lining of the esophagus, which those are some of the fighter cells, like part of your white blood cells. That would cause a lot of dysphagia, which is difficulty swallowing, sometimes nausea. It's very common in younger males. So that is something you would only know if you had that if you got an endoscopy, which is a tube, into your food pipe, and then they took biopsies of certain parts of the tissue and figured out that there's a high number of eosinophils. So that one's kind of interesting. If you have a friend with EOE, just give them a hug. There's pill esophagitis, which is if you were to swallow a really big pill and it were to kind of stick in your throat and break down and irritate, that would cause more like painful swallowing. Yeah. Same thing with infectious esophagitis. Either a bacteria, a virus, or a fungus has infected the lining. That will cause more painful swallowing too. And then you would also have some signs of sickness, like probably fevers, chills. And then there's also functional heartburn, which is, there's not technically anything wrong, but you have a lot of sensitivity to your symptoms. So you're having a lot of symptoms and the typical treatment may not be helping you because it's not targeting the functional side of it. And then reflux hypersensitivity is similar, where you've done additional testing and they've found that you don't necessarily have a lot of excess acid or regurgitation, but you're very, very sensitive to those transient openings. The typical medications for GERD aren't as helpful.
You're like physiologically predisposed to have these issues, but there's nothing you can do to help.
Yeah, basically.
Wow,
yeah,
wow.
and sometimes they can be related to if you're in a really anxious or stressful state, you're just more sensitive to those things. So sometimes it can be related to that. The diagnosis of GERD is either if you have classic, like textbook symptoms, you don't need any additional imaging and your provider can diagnose you with GERD and treat you. But if you have atypical symptoms, if it's not really clear, or if you have any concerning symptoms, like that would be worrisome for something else going on.
Like vomiting, weight loss.
Vomiting and weight
fever.
loss, for sure. Then they need to go look deeper. And also, if a provider is worried about cancer, I know that was running through your head when you were having your symptoms because you were like, there's a growth back there or something. Then they would need to image. And that's probably not the people that are listening to this are the ones that would need to be ruled out for cancer, but it would be more common if you're over 50, especially if you're a male, if you're white race, if you've smoked, or if you have a family history of an upper GI cancer. They've got to rule that out. There's something called Barrett's esophagus, which is when the lining of the esophagus over time, like after 5 years of untreated, pretty severe GERD, starts to change, and those cells actually change to look more like the small intestine cells. That way they can handle the reflux. But it's called metaplasia. Anytime a cell is switched to like another mature cell is not good because then it can predispose you for cancer in the future. So that's a condition that would have to be watched pretty closely. So if they need to go looking into the esophagus, that's called an EGD.
Esophagastroduodenoscopy.
Okay. Or an upper endoscopy, sometimes called a scope. A little camera is inserted down the food pipe, and they can look at the food pipe, take biopsies if needed. They can also do some procedures if they see like there's a stricture and the walls are kind of getting tight, and they can dilate that. They can go into the stomach and look at the stomach. you are put to sleep to some degree. So that is important to know. It's not just a office procedure. You have to get some sedation, and some people need to be intubated for it depending on what is going on with the procedure. So you had one done. Do you remember any of the like before and after?
I just remember like laying in the hospital bed and they put a warm blanket on me and I was so scared.
Oh.
And then they were like, okay, here we go. They put a little mask on me.
Count to 10.
Yeah, I was like, what am I doing here? But I just remember having a sore throat and some bleeding after. And then they like gave me imaging of what my esophagus looked like, and there was some evidence of reflux, which warranted medication from their perspective, but nothing further.
Yeah. So when they diagnose GERD, they're really just looking for signs of inflammation from frequent regurgitation.
But
and
for
reflux.
me personally, it ruled out like there's no stricture, there's no growth, there's no abnormal cell
nothing
change.
So I think it was good,
Yeah.
but kind of hard that they can't definitively say like we saw this exact thing and that's what it is. Anyway, there's also this test called pH impedance where they can place a little probe into the esophagus above the sphincter and they can monitor the pH levels, and then you match that with your symptoms. That way they can see how acidic things are and what's triggering it. So that typically would be like further down the workup if you needed it. Not as common. All right, so let's talk about the management of GERD. We would always prefer before jumping to medicine to try lifestyle things that are free, simple, easily accessible, and then don't involve a drug. So lifestyle things you can do. What worked for you first?
I would say sitting up when I was eating, like you technically want a 90-degree angle, unbuttoning my pants, loosening up the abdomen area, slowing down a little bit, so taking a breath in between a bite or maybe taking a sip of water in between bites. And then I did avoid certain foods, garlic, onion powder, any citrus fruits. I switched to tea. I gave up coffee for a time. I wasn't really drinking any alcohol.
So sophisticated.
No like fried food. Nothing.
Oh yeah, we missed that. Fatty
or like potato
foods.
chips, like anything like that was so bad. That was like instant symptoms, whereas some of the other stuff would come later, or like as I laid down, I'd be like, oh, I can't lay down because it's coming up.
Peppermint too. We didn't talk about that. Peppermint can relax the sphincter.
Oh yeah.
So peppermint gum and stuff.
I was chewing gum all day, every day. So yeah, from my bad breath. So what's a girl gonna do?
Hard. Okay, so
I just avoided things, like avoided foods. I did make sort of a food log of what to avoid, or like what foods triggered more symptoms, and then I was trying to eat a few hours before laying down, but I wasn't doing that super well. And then I was laying on my left side, and I had a wedge.
Okay, you were doing it all. Yeah, so not eating 2 to 3 hours before lying down is helpful. Like she said, if you lay on your left side, your stomach is on the left side, kind of up here, under the boob. And if you lay on the left side, then the gravity is pushing the contents of the stomach down, and the sphincter is up above it, so it's harder for reflux to happen.
And then the not eating or giving yourself a few hours before going to bed is just so that the stomach contents can...
They're out of the stomach.
They're gone, okay.
Yeah.
There's no chance that they're going to come back at that point. Okay.
No, that would be really, really weird. Okay, other things would be trying to figure out ways to lessen your stress. So deep breathing, yoga, stretching, going on a walk, things like that are helpful.
With smaller portions?
Smaller portions can help, yeah.
Or just, I think, really slowing down. Time yourself the next time you eat a meal. It's like under 5 minutes for me, or it was, which is crazy. So I think it just was like, there was no way my body could do that healthfully.
Yeah.
So maybe just slow down a little bit.
Be that annoying girl who takes 30 minutes to eat their meal and they put their fork down in between every bite and they take a breath and you're like, I'm going to kill you. But
instead of like elbow on the table, like, yeah.
You might have to be that girl for a season until you get your reflux under control. Other things that they're not like, they haven't really been tested in a well-designed study, but anecdotally, a lot of people do find success with acupuncture because it's stress relieving. Cool. Some people find help in taking a probiotic. You do have to find a very high-quality probiotic. Maybe sometime we'll have an episode on that because that would be interesting. That helps with your digestion, keeping it regular. There's some different supplements. I've tried ginger when I was pregnant, like ginger chews or ginger tea. That seems to help, just soothing digestion. There's one called DGL, which is a type of licorice, and that can help as well. And then if that's not working for you, you can try some medications. So starting out with medicines that are over the counter that you can go buy at CVS or Walgreens or wherever. H2 antagonists, histamine 2 antagonists are medicines that block some of the acid production, and that would be like famotidine, or the brand name is Pepcid. We've both used that. That works for a lot of people. You can take it either scheduled or you can take it as needed, or even preemptively. If you know you're going to go out to eat and you're eating pasta and you're drinking wine and you know that triggers you, you could take it.
Yeah.
You want to take it, I think it's 90 minutes before, and usually it depends on the brand. The duration is about 12 hours. So that's Pepcid. Antacids would be like Tums, so it's calcium carbonate supplements. There's some brands, Genexa and Wellbelly, that have clean ingredients, so if that's your thing, look for those. Those just neutralize the acid because calcium is very basic. So that's helpful. You can take those, again, just when you're having symptoms, take it, or take it right before a meal if you know it triggers it. You don't want to be taking a ton of those. Look on the package insert. It can cause constipation, and then you might just be getting a ton of calcium. And then there's another over-the-counter one called sodium arginate, which is interesting. It's not neutralizing and it's not blocking acid. It mixes with the acid in the stomach, and it forms like a barrier on top of the stomach contents so that nothing can reflux up. Then if those aren't working and you go see your provider, they might prescribe you some stronger medicines. Most commonly is a PPI, which is a proton pump inhibitor. That's the little pump in the stomach cells that releases the stomach acid, the hydrochloric acid. So if you block that, then you won't be producing acid as much, at least. So that would be like omeprazole or pantoprazole, Protonix, or Prilosec, very common brands. There's a few other ones. Omeprazole is common for pregnant people because it's been more studied. Those you are only on for a period of time, and then you're reassessed. It's typically an 8-week period, and then you go back and you see your provider and you see, can you taper off of them? Can you stop them? Some people do have to stay on them, but they do come with some side effects. So I always think it's important to just know about the medicine you're going to start, know the side effects, make sure that you are comfortable with if any of those were to potentially happen to you that you know. Sometimes it can cause an increased risk for infection if you're on it for a really long time, and you're at risk for infections anyway. So you might have seen that it could increase your risk for C. diff, which is a diarrheal infection, pneumonia. If you're on it for a long time, it can potentially cause some issues with your kidneys, not common. And then long term also could cause some changes with your electrolytes and your minerals. B12, calcium, and magnesium can decrease. So just good to know. If you're on it for a long time, you might need to have some blood work here and there to monitor that stuff. But the goal is that you're on it and it calms down the inflammation in the esophagus, and then you can figure out lifestyle things or as needed medicines after that. So that's the goal. There's also a medicine called vonoprazan or Voquenza. That is very similar to a PPI, but the way it binds is a bit different. So if you see that one, that's what that is.
So helpful. I feel like I see on TikTok and Instagram like H2, PPI, when I never know what they mean. So that's helpful.
Yeah. So
the least, like, what's the most minimal? Yeah. It would be
most
like
minimal
antacid?
Is probably an antacid.
Okay, like Tums.
And
then you do an H2 like Pepcid, and then you do a PPI like omeprazole.
Yes.
Okay.
A PPI typically would only have to be once a day. Its duration of action is long, so you usually only need once a day. Sometimes it's twice a day. You did 8 weeks total?
No, I didn't. I was supposed to.
That's right.
I did. I started on Pepcid or Pepcid Complete, which I think is calcium and magnesium maybe. But you can get them anywhere at any grocery store. And then I tried omeprazole. But I don't think I was taking it right because I didn't know what questions to ask. I didn't know that it mattered when I took it or for how long.
Yeah, sometimes that's not explained well. So if you're put on a trial, you need to do it. Do it for the 8 weeks, see if it works. It might calm down the inflammation and then you won't need it. I never got on a PPI, but I just took Pepcid. If you are refractory to these treatments, there's some cool like procedures that can be done. they can go in and do radio frequency to the sphincter, which causes collagen contraction.
Whoa.
Really cool. So then it's can close better. And then there's some surgeries. There's a fundoplication where they take the top of the stomach and they wrap it around to tighten that sphincter. Those would be if your symptoms are so bad and it's not treated by these medicines down the line. Hopefully that's none of you guys.
Like your sphincter's just not able to close, so they have to do things to help it close.
Yeah.
Or tighten it up.
Yeah, so that's like an anatomical issue is when a surgery would be helpful. That's GERD, guys.
That's GERD.
We always thought GERD was just for our lovely grandparents, but it hit us. Yeah.
It sounds so smart, too. Like, acid reflux is like, yeah, whatever. But GERD, like, drop that at your next dinner. We'll be like, shoot.
Fun and smart.
Yeah.
All right. Every time we have a guest on, we're going to ask them these 3 core questions. So we will answer them for you guys today since it's just us. You're stuck with us. So first question is, what are 3 words that a true friend would use to describe you?
Oh, goodness. Okay. I would hope that my true friends would say that I am authentic, that I am loyal, and I would say I'm very curious.
What's that called on LinkedIn when you like, someone's like, I'm organized, and then you
I
verify. LinkedIn people, tell us what it is.
It's
whatever.
like, yeah, you're agreeing, but there's a word for
whatever.
it.
I'm doing that to you. My words are genuine, I'm confident, and I'm also silly, but a lot of people don't get to see that. They only get to see the serious side, which is just so serious and boring. But then if you're a true friend, I get silly and fun.
So silly.
Okay, what are 3 health habits that you live by that you think make you a truly better person?
I would now say Pilates. I'm like a 6-month strong Pilates girl. Love Pilates. It's so fun, guys.
You went yesterday. I tracked your location.
I was there yesterday,
you.
yeah, Saturday morning. Never
What's your
stops.
favorite class?
Ass and abs.
Ass and abs.
Because isn't that what everyone wants? Ass and abs. I feel like it's making me stronger, but it's not like a crazy adrenaline like spike. I was doing a lot of like HIIT workouts, and I think I just enjoy Pilates. It's reformer Pilates to be specific.
Well, and you didn't love working out necessarily.
No, or like I would
Pilates.
I would like something for a week and then I would not like it anymore. But Pilates has been very consistent. So I would say find your local Pilates reformer studio. It's worth the money, and you meet cool people, or at least see familiar faces, and it's fun to like belong to a studio.
Do you feel like you're competitive in there? Like you're trying to like, you have to look good when you're in there and stuff?
I would say that could be a tendency depending on your studio. For me, no. Yeah. I mean, yeah, duh. But I really do feel like the energy in this particular studio is it's mostly women, and everyone's like cheering everyone on.
That's good.
And I feel more competitive with myself, and I really like the instructors, and they know kind of your level and how long you've been going. So they'll be like, you can change your spring load, or you can increase your weight, or come on, take the challenge. So it's competitive in that sense.
Yeah.
Because you're paying for like a coach, an instructor. So yeah, first would be Pilates. Second would be, I've been trying to get direct sunlight on my face in the morning, literally like 5 minutes. I don't know if that does much. I don't know the duration you're supposed to be doing it, but it's helpful for your circadian rhythm. It's that good, healthy sunlight right on your face.
Good.
Yeah, at least I just like feel really cool and granola with my coffee in the direct sun.
Do you also ground your feet?
No, but I should.
You should.
No, I'm wearing like fuzzy 3-inch slippers.
Well, that's fun too.
Yeah.
But maybe sometimes get your toesies out.
Yeah. And then I would say,
you told me you're trying to eat
food.
Yeah, you're trying to eat like nutrient.
I feel like in general, trying to eat more clean foods, and then just trying to eat more like nutrient packed or dense foods throughout the day. Yeah, and like eating before I'm working out, making sure I'm like fueled to work out, and then I enjoy my workout better.
Okay, mine are so like basic and nothing groundbreaking, but I just feel like it's what I have to do every day to stay grounded. And the first thing is I try to chug a big glass of water in the morning. I do put electrolytes in there. I like Element, but I only use like a third of the packet every day.
What's your flavor?
Raspberry, I think is the one I'm liking. Ooh. Yeah, it's good. And then I try to walk every day. Ethan and I, my husband, have been walking after dinner once our baby goes down, and we can just watch on the monitor. And it's so nice, one, for exercise, but more for like clearing your head. We try not to look at our phones, or I try not to listen to stuff when I'm walking by myself either. And I think that's been huge for my mental health. And then really prioritizing my sleep. We try to keep the phones out of the room. We have our hatch. We try to keep our room really cold and dark, and attempt like 7.5 to 8 hours.
So where are your phones?
We keep them in the bathroom.
Nice. Wow.
Yeah, it's good.
Awesome.
It's also good to not build resentment to your partner, because, I don't know, when I'm trying to sleep and he's like scrolling, and it's just not.
Well, and like there's just more opportunities for some like pillow talk if you're not on your phone.
Or other things.
Or other things.
I don't know.
Yeah.
Just like, don't be on your phone. The phone, I'm telling you, it's the worst thing. It's the worst. It's messing up everything.
I will say,
get it out as much as possible.
If I could add a fourth, I took Instagram off of my phone so I can get it on my iPad when I'm at home, which sounds really,
but you can't
really
be
silly.
Looking at it all the time.
Yeah,
like a
so
red
I'm not
light
like
or something.
Yeah, or like going to the bathroom, pulling up my phone to get on Instagram, or like
that's smart.
Filling up my water bottle, scrolling on Instagram. Like there's just, it's less accessible, and I do feel like I'm on it a lot less because of that.
I like that. Okay, final question. What's one area of personal growth that you're actively working on?
Actively working on? That might change my answer. What I'm trying to work on. Like
What's the difference?
Like actively working on.
Okay, you're thinking too hard. What's just an area you're working on?
I'm working on confidence. I think now in this season of life, people might assume that I'm confident, which is good. And I've definitely grown a lot in my confidence, even like professionally. But I can just compare like every single part of my life, like the foods I'm cooking, our grocery bill, our marriage, how well our dog is trained, my job, my clothes, like everything, which just either leads to discontentment or like it's comparison. So I'm either discontent or I'm like, ooh, I'm better than you. Like either way is not good. So just trying to be super present and trusting that the Lord has me like right here in this season, while also being inspired. Like there's that happy medium of like, oh, I really want to be more this way, because I think that's really healthy or cool, without being discontent or just like wanting what other people have. But it's hard. Yeah.
Taking Instagram off your phone is a good.
Yeah.
You are actively working on it.
Okay.
Yeah, I think so. Mine is something that on our walks, my husband and I have been talking about. We tend to get in this recurrent argument about whenever we get in a fight, I like to act like it didn't bother me, and I like to stuff it and just act really cool and chill. And then later on, when I've had time to just build resentment and fester and like have all these internal conversations in my head, and I've been like really mopey for like 2 weeks, it explodes out, and then we have to have a bigger fight.
Yeah.
So, and that's a issue with he and I, but then sometimes with friendships too, it's like I just, instead of dealing with the issue head on and right then in the moment and just nipping it in the bud, I let it wait, and then it becomes a bigger issue. So I'm working on just being more honest in those moments, taking the time to deal with it right then, and then be done with it, release it.
Nice.
Let it go.
Short accounts.
Namaste.
Someone told me to say ouch, like build that into your vernacular, because it can feel really awkward to be like, that hurt my feelings when you're like in a group setting, but just being like, ouch. And they're like, oh shoot. Like that was kind of weird.
Yeah, I like that. I'll try that on. Okay, well guys, that's GERD. Don't sleep on your GERD. It is a big deal if you're experiencing these symptoms. So I'm hoping that you learned something. If you deal with it, if a friend deals with it, you can send it to them.
One buddy out.
One buddy out.
One buddy out. That was good.
All right, bye.
Bye.